What we've done is looked at people who've gotten the COVID vaccine and looked at the vaccine effectiveness over time. And we looked as far as 32 weeks, so that's close to 8 months. And we're still seeing very good vaccine effectiveness, especially against severe outcomes like hospitalization and death. It's in the 90-something%. But even against symptomatic infection, it's still in the 80-something%. And this is in the general population, so not for the high-risk groups like people living in long-term care or necessarily the elderly. I think at some point boosters may be required for the general population. I think it's a bit too early to say right now, and I think it depends on the objective of the program. If the objective of the program is just to prevent all the severe outcomes, then it doesn't seem to make sense because the vaccine effectiveness still seems to be in the 90-something%. But if the goal is to prevent all infections, then you could make a case that we do need boosters because, as vaccine effectiveness goes down to the 80-something or 70-something, because we have the Delta variant, which is so contagious, the difference going from 90 to 80 to 70 will make a big difference in the number of cases that we see. So there may be a lot more transmission. I think there are a few benefits to holding off on giving boosters to the general population. Number one is you don't want to give a vaccine necessarily before you really need it because you're just using up a finite resource, possibly unnecessarily. And then the other is that maybe there could be more side effects if we give it too soon. So far, the data in Israel aren't suggesting that there are more side effects from the third dose compared to the second dose. The number one reason why we might want to hold off is that, there's so many parts in the world where people haven't received even the first dose yet. And if we're using up a third dose, that means somebody else in the world is not getting a first dose. And so I think we need to think a big picture here. The variants that are emerging are coming from places where there's a lot of spread of this virus. And the more we let it, spread in other populations, then it can come back to haunt us in the future. Where I think it becomes a little less certain is whether we should be giving third doses to older people living in the community who may be healthy and they don't have a whole lot of medical conditions. Maybe the vaccines are holding up well in that group. And I think we need more research to look at that. I mean, it might be prudent just to give it to them, rather than waiting until they, suffer the consequences of getting an infection and getting ill. When talking to somebody who is a little bit hesitant about getting the vaccines, my approach is that, it boils down to three things. Number one, is it a serious disease? And yes, COVID can be a very serious disease. Sure, there are a lot of people who have it and they have mild symptoms and they get better and they're fine. But there are a lot of people who are getting really sick from this. And even the people who aren't getting really sick, some of them can get long COVID, where they can have symptoms that can last for months. Something like 7 billion doses have been given around the world already. So this is the most studied drug or vaccine that's, ever been made. And so, we have really good data on the effectiveness. We know that these vaccines are very effective. And we also have good data that these vaccines are very safe. The rate of complications is very low. And basically, the bottom line is that the risk of these complications and other bad things are way higher from getting the virus compared to getting the vaccine. And that's why there's such a strong recommendation for everyone to get vaccinated. You can protect yourself and you can also help to protect those around you.